The HSE have confirmed that the successful candidate for the post of GP in Bangor, Erris and Glenamoy must accept the offer by this Friday. There has been fears in recent months over the future GP services in the area. The HSE say the post of GP has been offered to the number one candidate on the panel for Bangor, Erris and Glenamoy. This follows numerous efforts by the HSE to recruit a GP for both Bangor, Erris and Glenamoy independently, which proved unsuccessful due to a lack of interest in either post. The initial offer for the Bangor Erris Glenamoy post was made on February 17th, with a further communication from the HSE on Friday, February 21st, requesting a decision by close of business this coming Friday. If the successful candidate accepts the post, it is intended that he or she will start immediately. The HSE say they intend to continue to provide services from existing locations. However, they say they cannot comment on the contractual arrangements of non-HSE staff. Erris-based Sinn Féin TD Rose Conway-Walsh says she has written back to the HSE that it is really important that both clinics are left as they are. Deputy Conway-Walsh is hoping to get reassurance from the HSE.
What they have said is that, obviously, following the recruitment process, the job has been offered to the successful candidate, and that the successful candidate now has until this coming Friday, close of business, February the 28th, to make a decision. And it is their intention that if they accept that he or she will start immediately, and if not, the post will be offered to the next candidate on the panel, who in turn will be given 1 week to accept or reject the offer.
So, effectively, I suppose, in layman's terms, what it means to people of Bangor and Glenamoy, does it mean that both clinics are going to remain open as currently is?
Well, that's it. That's what I sought clarification around as well. Now, they say the HSE intend to continue to provide services from existing locations, but that they cannot comment on the contractual arrangements of non-HSE staff. Now, I have written back to them again to say there's two very important things here. First is that, okay, the areas may be combined because the first recruitment attempt wasn't successful, but they need to keep, whoever gets that contract needs to keep the 2 GMS allowances to cover the geographical area that's going to be served. So it's really important that a condition of the contract be that the 2 existing clinics in Bangor and Glenamoy be, including the staff there, be left as they are, and that Geesala also has the clinic running as it has been. And that is vital to that area of Glenamoy, Bangor and Geesala. So I'm hoping that they can give reassurance on those locations, because we cannot allow the situation to be that it's just between whoever gets the contract and the community. We're talking about vital, essential healthcare services. The HSE have an enormous budget and a responsibility, as do government and the minister, to make sure that that's provided. So it cannot be just left to a self-employed person, whoever gets it, to make those decisions. Now, they've also said, Michael D., regarding the out of hours, that it's the intention of the HSE that they will be covered, but again, that it's a contractual matter. They must intervene there as well. There must be out-of-hours services, GP services available for that community and for all of the people there. It cannot be just left on an ad hoc basis. People need to have confidence in the health service that's being delivered to them in the area. Now, of course, as well, the ultimate thing for Bangor and for that area is that we have a primary care centre, which we've been pushing for a long time. That primary care centre, they sought expressions of interest in it, and they've received expressions of interest. That must be proceeded with, because we not only need the full primary care centre that's fully staffed to service that area, we also need the provision for the helicopter pad that can also bring people in emergency situations to the acute hospitals.
Sinn Féin Deputy Rose Conway-Walsh.